Hello everyone, my name is AZIZ Chaudhry. I'm a primary care physician and clinical director of North CLACTON Medical Group. Today I would like to explain about some minor surgical procedures which are performed in primary care sector. In the primary care, there are certain physicians who are accredited and trained to perform minor surgery within the community. Certain simple procedures can be done on the same day when you come for a routine consultation. They include injections, which can be a joint injection to relieve the pain in your aching joint. It can be to inject the symptoms of bursitis, symptoms of plantar fasciitis, or tenosynovitis or tendonitis to treat conditions such as tennis elbow, golfer's elbow, carpal tunnel syndrome, and similar conditions. Also, certain swellings or collection of fluid around your joint or in other parts of body under the skin which are easily accessible can be aspirated on the day of your consultation. Small lesions such as skin tags or warts and verrucas on your skin can be destroyed by applying a form of energy such as heat or cooling. Heat is applied by a special machine called CHAUDHRY, which may require a small amount of local anesthetic to be instilled around the lesion before destroying. However, cooling or freezing does not require any local anesthetic. Results are almost the same by both type of energy. The other conditions which are normally known as lumps and bumps, which include cysts, lipomas, fibromas, foreign bodies, and certain other conditions such as pigmented lesions, and a form of skin cancer called basal cell carcinoma, they all can be surgically removed within the primary care. You may have been referred by another physician for the minor surgical procedures. The surgeon will re-examine your lesion and discuss the way he or she would like to perform the surgery and what result you both want to achieve. The surgery is performed on a dedicated surgical list, which is performed in a well-equipped treatment room in the presence of an assistant to help the surgeon. If suitable for this operation, you will be consented, and during the consent process you will be explained the potential complications, which usually are pain, bleeding, infection, scarring, altered color of scar, overgrown scars, and sometimes the need to redo the surgery. However, incidence of complications within the primary care sector are extremely low. Allergic reaction to local anesthetic is very rare and only happens locally where the injection has been given. The systemic reactions are extremely low. Fainting can happen and can be easily managed within the primary care sector. After the consent and application of local anesthetic, the lesion is removed under sterile conditions. Once removed, the lesion is sent to the lab for histological examination to confirm its benign nature and that there is no sinister pathology. Also, it gives assurance that the lesion had been removed in its entirety. The surgeon then makes sure that all the bleeding has been stopped and the open wound is then closed by appropriate sutures. A sterile dressing is applied and healing process is complete within 10 to 15 days. It usually does not require any further intervention or any further treatment. Rarely you may have to use some painkillers once the local anesthetic effect is gone. To conclude, there are several minor surgical procedures which can be offered within the primary care sector. Certain physicians are trained to even offer ingrowing toenail surgery as well as treating piles within the community. Vasectomies also can be done. So if there are any lesions which are concerning or worrying, it is important to contact your physician, who after examination may be able to offer you minor surgical procedures within the community without the need to go to hospital.